All right. All right. Looks like I'm live here. It's my first time with technology like this, so I will try my best to go. Let's get right into it. So I'm going to start doing these webinars, once a week, just to kind of share some knowledge and some information. They're totally free, no strings attached. Just want to give a better idea about my system, what I do, how I can help, and everything like that, and just really change your mind as a massage therapist to the idea of like becoming a solutions provider instead of a service provider. So one of the main tenets of my system is thinking critically and being able to figure out exactly what's wrong with the client, because as I always say, you can't fix a problem if you don't know what it is in the first place. So I made a PowerPoint up. We're going to go through everything. What I ask is, if you're watching this on the live thing, you have any questions, put it into the chat. If you watch it on the replay, put it in there as well. And then what I'll be able to do is go back in and individually respond to each one of those questions as we go. Still trying to figure out the technology on this, but let's get right into it. 12 must-ask questions to figure out exactly what is the cause of an injury and pain with your client. Those of you that don't know me, my name is Dr. Matt Maggio. I'm the creator of the Peak Method and the founder of the Soft Tissue Revolution, where we show massage therapists how to easily double their income, all while working 50% less and being taken seriously as a healthcare provider. Let's get right into it today. I'm looking outside my window, and it looks like they just started mowing the lawn too. So hopefully it doesn't mess with the audio too much, but we're already going, so let's roll. So my first question I always say is, how can you ever fix a problem if you don't know what it is in the first place? Think about that. How can you ever fix a problem if you don't know what it is in the first place? And in musculoskeletal injuries, this happens all the time. Nobody really knows what's going on. They do these studies all the time, and they usually say, hey, chiropractors diagnose based off what they're trained in. Physical therapists do. Massage therapists do. Everyone like that. They diagnose based off what they're trained in instead of actually figuring out the problem. I give this analogy of, say you went to the mechanic and you're having car problems, and you bring it to them and you go, hey, my car's making this weird noise, and they take it out back and they just start banging on it and hammering away. You'd be like, what in the hell are you doing? Don't do that. But you'd want them to run some diagnostics and figure out what's going on. But when we get into an injury and we start going, we just jump right into this idea of like, let's just get in there and start doing some shit and see what happens. I hear these therapists tell me like, yeah, once I get my hands on that person, the tissue talks to me and tells me what to do. Bullshit. But basically, you have to figure out what it is, because you can't fix a problem if you don't know what it is in the first place. So, importance of thinking critically. This is the area in my system that people fight me on the most, especially massage therapists. So I get excuses all the time. Excuses made by massage therapists. They go, well, in my scope of practice, I am not legally allowed to diagnose, so what do you want me to do? And I think that's a cop-out. Just because you can't legally diagnose doesn't mean that you don't have to know what's wrong with the client. I already went over the car problem analogy. It's like bringing your car to the mechanic and they just start working on it before they ever know. So you can keep telling yourself that story of like, well, I'm not allowed to diagnose, and those are limiting beliefs. You got to know what the heck's going on with your client. And nobody starts with that. Like, we all should be able to agree universally that we can't fix a problem if we don't know what it is in the first place. And the goal of my system, and the goal really of any treatment, is you always need to get to a tissue-specific problem list. Then you can apply the correct treatment. We get in this all the time, like these, I call them junk box just diagnoses. They're like, things are tight, they're not firing, they're weak. It doesn't tell you what's going on. In my system, you're able to figure out, and we're going to do this on next week's webinar, I'm going to go through the 7 problems in the body. It's a bone, cartilage, disc, ligament, nerve entrapment, tissue problem, or tendon. So once you figure out what the problem is, then you can apply the correct treatment and actually fix it. So thinking critically is the key component to my system. And a lot of people ask me, when I say, hey, we do shorter treatment times, like a 15 or 20 minute follow-up treatment, how are you able to do that? We do that because we collect all this data on the front end and we know where to go. We're almost like a sniper approach. A lot of treatments are very shotgun based. They just do a bunch of stuff and see what happens. We're a sniper. We line it up and we know exactly where to go. And this is how you earn that quicker treatment. But you got to know what the problem is in the first place. So first question that I always ask is, how old are you? Very simple. How old are you? Now, in an older population, you're going to see more of what's called degeneration. Degeneration is just a general term that things just wear out before their time. So you're going to see this in cartilage, you're going to see this in a disc, you're going to see this in the bone, and potentially in the tendon as well. And another thing, older populations will just take longer to respond to treatment, and they're not going to get as optimal results. One thing that we teach in our system, and we teach a functional-based evaluation system where we get a percent function of how that person's doing, and then we get an idea of where we can get them. And usually we say, hey, we get you anywhere from 80 to 85 to 90% better. When it's an older person, I'm lowering that number. That's in the 70, 75, maybe a little bit lower, but setting those expectations right and knowing that it's going to take longer for an older population to respond. The problem with the older population is usually they have more money, but they have less health. So they always think that if they always think they can buy their way out of all the dumb things that they did over the years, and that just doesn't happen. As you get older, your health is less and your money's more, but you can't buy your way out of that. So a lot of the older people have, I guess, unrealistic expectations about where they're at. They tend to fall for like things like stem cells and like these gimmicky type of treatments because they want to basically cheat father time, and you can't cheat father time. Now, younger people, this concerns me too when they're having bigger problems. You know, younger people haven't lived long enough to be so beat up. So a lot of times when I'm getting like some severe symptoms, as we'll go through the rest of this, I'm starting to think, hey, there's a bigger problem in there, potentially bigger pathologies that we miss, because these people and these younger people are having bigger problems and they shouldn't be having them. So you got to start to explain that as well. I've caught some really bad situations in some younger people because it just didn't make sense. They were presenting like someone that's an old, degenerated person, but they haven't lived long enough to have those problems. So it really gives you an idea of what's going on. Next question I ask, are they male or female? Now, I usually answer this one on my own. This is just a disclaimer. I usually answer this one on my own to assure that I don't offend anybody. You know, we're in this whole world of you don't know what people's genders are, things like that. You don't want to offend anybody. Normally, you can just tell when you look there, but if you don't really know, just skip it. It's really not worth making that person feel uncomfortable or you feeling uncomfortable for who you are. But a lot of times with females, they have different types of hormones that release, and you're going to see some laxity with females. So I see this a lot in my female population where they have more range of motion. So a lot of times they come in and they're like, yeah, I'm moving really good, but that's happening because of the laxity in the ligaments as well. Other things is just hormonal spikes with females right around menstruation time. And that's a lot of like when I have some of my headache people, possibly low back people, where I'm like, does this line up with their menstrual cycle and things like that? Just collecting a little bit more data on that. Now, here's the thing. Women tend to have more mobility, but less stability, where males have more stability, but less mobility. So what does that mean? I'll use an analogy of yoga. So women tend to get, I know women do more yoga than men, but women tend to get injured more in yoga than men because they can get into those positions, but they don't have the stability and strength to hold it, where men just can't get into that position, so they don't put themselves in a bad place. So a lot of times men have more strength, but less mobility, and women have more mobility and less strength. So sometimes with the treatment, you need to factor in for each part of that and maybe give the female more strengthening and the male more mobility from where you see, because a lot of times the men can power through some of your evaluations and treatments. Next one, where do you feel most of the pain? Details matter here. It's not just like, oh, my neck hurts or my shoulder hurts. Details matter. I give this example all the time, and I have a really good video where I talk about, is it a neck problem or is it a shoulder problem? So a lot of times people will come in and they'll be like, my shoulder hurts, and they'll push and they'll tap back there. That's not a shoulder problem. That's actually a neck problem. So I always say, does your shoulder hurt or your neck hurt? Because that's the difference. And a lot of times clients don't really want to give you a lot of details. It just gives me a better idea of where I'm going, and I know where that pain is. And then also have them specifically point where they're just like, oh, my whole shoulder hurts. And I'll ask them, I'll be like, does it hurt in the front? Does it hurt in the back? Does it hurt here? Are you getting anything down the arm? Be very specific because people don't really understand that you're really trying to dive into those details and they just want to say general statements and explain to them why you're asking these questions. So it's important so you know what you can do so you can actually help. What does the pain feel like? This gives me a really good idea of like what's going on. And I always give a whole list. I'd be like, so how would you describe the pain? Is it sharp? Is it dull? Is it aching? Is it throbbing? Is it stabbing? Is it numb? Is it burning? Is it tingling? You ever go to a restaurant and they tell you all the salad dressings or all the beers on tap? That's what it sounds like. It gives you a better idea of the quality of the pain that's going on. Let me go back here. So the quality really gives us a better idea of like what's going on because a lot of times if I'm seeing things like numbness, aching, burning, tension, it's giving me an idea that possibly there's some nerve involvement, there's an entrapment. If I'm getting like sharp stabbing pain, it really goes back into my seven components of those injuries. And we'll cover those in the next videos next week with like the 7 problems. So how bad is the pain? So this is what I always say. On a scale of 0 to 10, 0 being no pain, and 10 being you wouldn't care if we cut it off, what is the worst that pain's ever gotten? So once I get that answer, I like to get a couple more answers in there as well. And if they say, hey, it was 8, I like to know, like, when was the last time you had an episode that was that bad? I'm trying to get an idea better if this is more of an acute thing or more of a chronic thing. It gives me like that time level and those temporal factors from where we are. And then I also ask them, what has it been on average over the last 30 days? It gives me an idea of like what this person's living in and where they're going. And in all honesty, the ideal range for musculoskeletal injuries and what we can do as soft tissue specialists and manual therapists is I really like to be in that 3 to 7 range. That really gives me a good idea. 3 is enough where they take it seriously. 7's where it's pushing that limit, but it's still something that we can get in there and start to work on. So I really like to be in that 3 to 7 range. One last thing is this helps me figure out if there's like a psychosocial issue in there. So there's a bunch of components to injuries. One is like a structural thing. One is metabolic. Another one is the tissue. And the last one is just like their mind and where they are. So if you've had one of those clients and they're like, I'm a 10 sitting there right now, and they're just having a conversation with you, you can start going in your mind that think, hey, maybe I do have a psychosocial component with that. And knowing that you have this, because it ends up becoming a bigger problem down the road if you don't address it earlier. Like I said, if someone's sitting there and they're a 9 or 10 and they're just having a normal conversation, there's something else going on. This could be more in their head, or this could just be someone that's not in touch with reality of how things are going. And those people end up being a headache for you and a bigger problem down the road because they're the ones that'll like come in and be like, oh my God, this is the best I've ever felt. Then the next time they come in, they're like, this is the worst I've ever felt. And it's just that roller coaster up and down. You don't want to really be able to you don't want to have to deal with that. Now, next question is, what can make it feel worse or flare it up? This is a really good one for me as well. I call it the provocative. I always want to have something that makes it feel worse. It helps us really narrow down if it's a true musculoskeletal injury. So they might be like, yeah, my neck hurts in the morning, but after I drive in the car for like an hour, it goes from like a 3 to a 4 or 5. I always want to have some type of thing that makes it worse. It gives me a better idea of what's going on. Next thing is you get a better idea of like what the client's doing for their activity and their load levels. Are they stuck sitting at a computer all day? Are they commuting really long? Are they having all these different type of issues in there? Because part of the issue that you run into is like managing that client's load in between the visits and really getting a better idea of what's going on. So I always want to have some type of provocative thing. It also gives me an idea of how they're responding to the treatment and they're responding to the care. It gives me a better idea of what they're doing. And it's like, hey, before I could only sit for 5 minutes before I got pain. Now they say, hey, now I can sit an hour before I have pain. That gives you real objective data to give to the client to show them that they are making progress. Next one, is there anything you can do when it gets bad to help it feel a little bit better? I call this a palliative thing. So it could be something really minor. They could be like, hey, if I go and take a walk for 10 minutes after I've been sitting for an hour, my back pain goes from a 6 to a 4, or if I lay down or it causes some type of change. If I get a massage, if I do a stretch, if I take an ibuprofen, something. I want to see something makes it worse and something makes it better, because it really helps us determine if it's more of a structural issue, like a bone, cartilage, disc, or tendon, or some type of soft tissue component as well. And a lot of times a bone, cartilage, and disc thing will have a lot of provocative things, and it'll have a good amount of palliative things when they can lay down. And that gives us a better idea. Over the years, though, I've caught some really bad situations like a bone infection. I've caught cancer on a couple of clients as well because it didn't make sense. They're like, hey, no matter what I do, I'm always at like a 6 or 7, regardless of what I do, and nothing really makes it better. And a lot of times those are things that present with bigger problems like red flags, like cancer and things like that. I've caught it in several clients because we went through and it didn't make sense. So it's like, what I always want to see is like, hey, they're in that 3 to 7 range. They have something that can make it a little bit worse, something that can make it feel a little bit better. When nothing changes, that's when I go, oh crap, there's something else going on, and get into the root cause of that, because you have to be able to line all the dots up and make sure that everything makes sense. Next one, have they had any accidents or trauma to the area? Yeah, that really gives me a better idea. So basically when I'm looking at something, I want to know pain. If there's pain without trauma, it usually tells me that there's some type of compensation going on where something's getting overloaded because something isn't working. This could be posture-related issues. This could just be dysfunction in a certain area. Now, symptoms are everything versus the symptoms don't matter. There's 2 types of camps. There's one side that's all about, hey, symptoms are everything. We're only going to deal with symptoms and get rid of symptoms. There's the other side of like, symptoms don't matter at all. Stop chasing pain, whatever the hell people call it. But there's something in the middle. You want to be somewhere in the middle, because symptoms tell us it's a problem, but they're not everything as well. So it's really getting an idea of being able to figure out where these symptoms are, where they're coming from, and what's going on. Because a lot of times when there is pain with trauma, it gets me to focus on that area first. But if there is no trauma or no accidents, I'm kind of doing a more global look and really trying to figure out where that dysfunction is coming from. It really helps dictate where my treatment is and where it's going. Next one, have you seen any other practitioners for this problem? Next question I ask is, I'm like, what did they tell you was wrong? This is like an area where I kind of try to throw those other practitioners under the bus, because, you know, a lot of people come in and they'll be like, you know what, they never actually told me what was wrong. They never gave me an explanation of what's going on. And that can really give a better idea to the client that you know what you're talking about and you know what you're doing, because those other people didn't. As I said before, how can you ever fix a problem if you don't know what it is in the first place? So when I ask the client this, I'm like, okay, who else have you seen? Okay, what did any of them tell you was wrong? They're like, you know what, they never did. I kind of just get a straight face and go, okay, well, yeah, that's probably why those other treatments didn't help you out, because you can't fix a problem if you don't know what it is in the first place. Then I also ask, did any of those treatments help? It gives you a better idea of like where they're at, how frustrated they are, if they've ever had any relief from anything. So one of the criteria for my clinics and what we work with is you have to have a neck, shoulder, or low back problem. Number 2 is you've had to been dealing with that problem for at least 6 months. And number 3 is you've had to see at least 2 other practitioners: chiropractor, physical therapist, massage, orthopedic surgeon, acupuncturist. What this does is allows people to take you a little bit more serious. Sometimes they got to go through a lot of crap and a lot of issues to get to somebody that's quality like you are. And when you can present it the right way and you're like, hey, I know you've been through all this, but this is why I'm different. This is why I'm a specialist. This is why I'm an injury solutions provider, can really help put you ahead of people in a different level. Next one, do you do any exercising or working out? This always gives me an idea. Gives me an idea of load factor, so we know what we're up against. You know, are these people going balls to the wall all the time and just really destroying their bodies, doing a lot of extra workouts and things like that? It can really help me understand too if I'm dealing with someone that has some type of psychological addiction. You know, these are the people that just work out all the time. They're like, hey, if it's not balls to the wall, it doesn't matter. And if I don't work out, I'm going to die. And a lot of these people have some psychological issues in there, and it helps you kind of like tread an easier path as you go through, so that you're not taking it all away from them. Because that's what's going to happen is a lot of these people that have these psychological issues, they continue to go to these providers that tell them what they want to hear instead of what they actually need to hear. And I always say exercise is like a medication. It can be effective, but a lot of people overuse it and do that. So it helps you communicate better with the client about what's going on and what to do in between the visits, and helping them understand that what they're doing is actually destructive. You're going to help them get back to there, but they have to take it easy. They have to cut their load down, because the treatments aren't going to be able to work if you don't do that. And it just gives you an idea if they have more of a mobility or a structural type of issue as well. if they're having different type, like you can ask them questions like which type of activities can really, flare it up or cause that. And that can also go into the idea of like giving them some ideas that they're responding to care really well. They'll be like, hey, before I couldn't get into a down dog in yoga or I couldn't press over my head. Now I can. And then they're giving you details and giving up data about the idea that treatment is working and they're making progress. What do you do for work? This is always a really good question for a couple reasons. It gives me an idea of what I'm up against. I've been amazed at, I'll get some of these clients in that are just overweight. They don't really take care of themselves, but they're like blue collar workers. They might be construction workers. They might be just out doing stuff all day. They do so much better with treatment, even though you look at them and like they got a beer belly or they're unhealthy, but they're out moving and they're doing stuff all day. The people that are usually a wreck are the ones that are stuck at a desk all day long, and just sitting just wrecks everything. It wrecks the spine, wrecks the ligaments, everything like that. So you get a better idea of like what you're up against and what they need to do. Like a lot of times with my blue collar workers, people that are up active all day, I need to get them to take more rest. Whereas my people that sit all day, I need to get them to move more. So it really helps you get an idea of like what they're doing, what their factors are, what their load factors are. So you can really make sure you custom the treatment the right way to get the best results. Went over blue collar, white collar workers. Last one. This is my most important question. And once I'm done getting all that information and I ask the questions through that flow, I'll be like, hey, let's just say her name is Mary. I'll be like, okay, Mary, I have all the information I need so far. Is there anything else you'd like to add that's important that we might have missed? And this is the last one that I ask them. And I look them dead in the face. And I say to them, how is this problem affecting your quality of life? Take the time to actually listen to people. You'd be amazed at how many people never get heard. They never get listened to. They get kicked around the whole entire medical system or the medical merry-go-round, as I call it, and they're never actually listened to. And when you can look them in the face and like be genuinely there, empathetic with them, it's amazing. I had a client a couple weeks ago, and he said to me, he goes, you were the first one of the 8 people that I saw that actually asked me how this is affecting my quality of life. And you actually gave a crap about me. And we're missing this so much, this like interpersonal like connection with other humans. And when you can empathetically look at somebody and say, how is this affecting your life, and genuinely care, it puts you on a whole different level. And that person is going to listen to what you say. They're going to be invested in treatment, and they're going to know that you truly care. So at the end of the day, people buy off of emotion and they justify with logic. And if you can connect with them emotionally and let them know you understand their hurt, you understand that that pain just isn't in their head, that other people have failed them, but you're the person that's going to be able to help them and be a solution, it's going to put you on a whole different level because people buy off emotion. Next one is this social proof factor. A big thing in influence is knowing that other people have done it. So when it's done and I go through this and like someone has this, I usually just insert a story of another client that we had. I'll be like, hey, Mary, I had a client just like you named Lisa, and she came in and she was getting daily headaches. She couldn't read, she couldn't focus, and she was running out of hope. And we really were able to help her out and put her in a really good place. This really helps too when you get more and more testimonials from your client. Like when I'm done talking to this person, I might send them that testimonial too, because they want to see that other people are like them and other people have had results. So that social proof factor is huge. So getting and asking these questions is just so important. And it's the cornerstone of my system, the PEAK method, of getting to a tissue-specific problem list so you can fix it effectively, faster, more thorough, all that kind of stuff. So how do you implement this into your own practice? Because I know this is totally different from what traditional massage does. A lot of times you might get a new client in and they come in and they fill out an intake form. You might have a couple minutes to spend with them, and you're just jumping right into treatment. I call that like the service provider. You want to be that solutions provider. So how do you implement this into your own practice? First thing I say is do these over Zoom. Do them over Zoom. Like we always offer in our clinics and everyone that we work with, we call it like a no-charge injury consultation. And I start with Zoom because it's most preferable and it's professional. You get to be face-to-face with that person. You get to ask the questions, and they're looking at you for 3 things. They want to see, are you sharp as a tack? Are you enthusiastic as hell? And are you a true expert at what you do? And this really just helps with COVID. It helps with everything because you can have that face to face with them and talk to them before they come in. I know it's not ideal for everybody, but this is the number one thing that I recommend. If Zoom doesn't work, do it over a phone call. If a phone call doesn't work, then do it over an email. But regardless, you need to collect this data before they ever come in. Then you can have some time to think about it critically. And we'll be able to put this together with a video next week of going into the 7 problems and figuring out exactly what's going on, because you need to slow down that process a little bit. I always teach the therapists that work with me, you have to go slow in order to go fast. And this allows you to just slow down. You're not feeling rushed. You can actually think about what's going on. You do this consult before they come in. You can have 10 or 15 minutes before they come in, and you can sit down with it and be like, hey, based off of this, it sounds like there could be a bone issue or cartilage. What am I going to look at? And based off of that data, we're able to tell you in our system specifically which functional evaluations to do. What those functional evaluations look like can tell you about what's going on. In all honesty, just commit to having this done before the client ever comes in. It gives you time to think and slow down. As I said, gotta go. In order to go fast, you must go slow. But so many people don't want to do this. But nobody else out there is doing this. I assure you, PTs aren't doing this. Chiros sure as hell aren't doing this. Orthopedic surgeons aren't doing this. This just puts you in this whole level, because what I'm trying to do is change your mindset and your mentality of not just, hey, I'm just a massage therapist. It's like, no, I'm a soft tissue injury specialist. I fix chronic and unresolved neck and shoulder pain without the use of drugs, injections, and surgeries. I'm an expert at finding and fixing scar tissue and reducing inflammation from chronic musculoskeletal injuries. This leads to a significant increase in overall functioning and long-lasting pain relief. That's your elevator pitch. That's what you do. And somebody that takes the time to do this, they look at you and they're just like, holy shit, you're on a different level. I've had some people in my coaching programs where people thought they were doctors before they even did that. And they had to correct them, be like, no, I'm not a doctor. I'm a licensed massage therapist. But you just look at that and you're at just a whole different level, and you're taking so much more seriously as a healthcare provider. You're not just a massage therapist, but you have to commit to doing this and learning how to do this. And we teach all of this in our free training. And there are several examples on my YouTube channel of me doing these Zooms. I've done them over Zoom with several other massage therapists that are in some of our training programs. So you'll get a better idea how I go through the flow, what I say, how I explain what's going on, and how I really collect the data. So I think that's all I got. Thanks for watching. Number one, leave any questions below, and I'll be sure to answer each one, unless it's something crazy. I want to try to answer all your questions the best that I can, the best of my ability. Number two, get access to our free training. There's a website listed below if you're watching this on YouTube, which is our free training. No strings attached, no obligations. You're just going to get an introduction to my system, thinking critically, and get you on the path to going from a service provider to a solutions provider. We just put that all together. Really dives into a lot of things on functional testing, palpation, recognizing pathologies and red flags, and just really kind of changing some of your mindset around the idea of you're not just a massage therapist, you're a soft tissue specialist. Lastly, reach out to us for any questions or topics that you might have or you want us to cover. We're always here to help. I appreciate you guys watching this. If you like it, give it a like, a comment, a share. If there's anything you want me to cover, ask in the comments, reach out. We're going to try to do these live each week. If the live recording wasn't as great, I'll probably just do them on Zoom and then share them. But I appreciate anybody that hopped on and looked at this. And thank you for listening. And I hope this really helps. And we'll see you guys on the next one. Bye.